Our health is intimately linked to where we live, work, and play, our communities. The health of our communities, in turn, is profoundly affected by our collective beliefs, attitudes, and behaviors. To live better and healthier lives, we must therefore fully understand how to improve our collective health and the health of our communities.
Community health is a lot of things. There are a lot of careers within community health, and I think for your average high school student choosing a major to go to college, or your average college student, they're kind of looking for, what will I be when I'm done? Just tell me what I'll be tangible. Generally, students who want to get into the field of health, they want to help people. Community health is a great option for that type of a student. And through their education with us, we really have them focusing on a few different questions. And the first question is whether or not there's a population they're really interested in working with. And for one student, it might be they really want to work with adolescents. They really want to work with the senior population. They want to work with IV drug users. They want to work with, a very specific constituency. The second question we ask them to entertain over time is whether or not there's a setting that they're very interested in working with. We have some students who know they want to be in a healthcare setting. We have some students who know they want to be in a community health center kind of setting, a nonprofit organization, an after-school program, a school-based setting, so a setting of interest. And the last thing, what health content area are they very interested in? And some students really, it's kind of fitness and nutrition. Other students, it might be mental health, it might be diabetes, so they have that interest area.
When I entered the field, I knew I just wanted to help people. I didn't know exactly what I wanted to do, I just knew that I wanted to help people. So I was originally in nursing, and then I spoke with Nikki Champagne, and I kind of went up to her and I said, I don't know exactly what I want to do, I just know that I want to help people, I want to make a difference. Help people in a way that I'm providing them with resources, and like if they see me in the streets, they can say, that lady right there, she helped me, but in a way you helped yourself because I gave you the resources and you made use of that. And Nikki just smiled at me and said, you're getting into the right field.
We really settle in on a set of transferable skills, things that students will be able to use kind of regardless of the population, setting, and content area of interest. We definitely train students to assess. Along with the assessment, we certainly want students to be able to analyze data and synthesize that into good quality information that we can then plan programs, to implement programs, to evaluate programs. We also, across the board, are training students how to advocate for health, how to advocate for health promotion, making sure that they are part of the constituency that are fighting for needs of communities. We really want to make sure that we don't have students who are accepting the status quo, and we want our students to say that's not enough. We have got to do things in our schools, in our workplaces, in our communities if we really want to have sustainable change over time.
I think the curriculum gives you a nice foundation to work off of. You do a lot of practice press releases, you do flyer creation, you work on curriculum development where you're learning how to put together a lesson plan, and then you actually have the opportunity to implement it. When I was a senior, I believe we went out and I had a topic. I had to prepare a presentation, an hour-long presentation, which was intimidating at the time. But I then took that presentation and implemented it at the dorms, the freshman dorms. I was able to not only take the information that I learned in school, but then take it and put it into practice. So having the internship allowed me to put something on my resume, which was fantastic.
With community health, we have such an array of options in terms of career directions that you can follow that we're not a soundbite. We need a little bit more time to talk to the student and to really offer the student information about the kinds of career paths our alumni have taken and to show the eclectic nature of those different career paths and graduate school options.
While most people easily recognize the more well-known health professionals such as doctors and nurses, they may not be as familiar with community health and public health professionals.
It's amazing. You could be a teacher, people work for hospitals, people work for nursing homes, emergency preparedness. I work for the health department, and my range of responsibilities are from opiate overdose prevention and going out into the community, from like the shelters and the homeless and people that are actually using heroin and using drugs, to education. As the field becomes more and more known and as it becomes more recognizable, the opportunities are even going to grow further.
help make our communities to become healthier places in which to live, to work, and to play. Become a community health professional.